If I haven't said it already, I'll say it now. One of the things that they told me before we had this surgery was after the surgery, I might be confused. After the surgery, I might be forgetful. Those kind of things bothered me before the surgery. And since the surgery, I asked them, what do you mean? And of course, one of the things they said was you could have a stroke and you could have that kind of effects and things. So it causes you to think about things differently, both before the surgery and then after the surgery as you contemplate how am I doing, how am I feeling. And I can tell you that I am a little slow, a little slower than I was before the surgery, a little bit more difficult to keep my thoughts collected, to speak in a manner that I want to speak without pausing and thinking for long periods of time. I told you this videos were going to be random thoughts. Continuing, though, I'm going to say I couldn't be more pleased with the doctor who did my surgery and his team. They did an excellent job. And the way that they go about their business and deal with their patients after the fact impressed me. I like the way they do things. I like the way they're organized. I like how efficient they are. I like how they discuss different situations that are occurring as we progress through uh, recovery. I like the way they keep me informed. I like the way everybody on the team participates in the decision. And then I like the way that once they have arrived at what they believe the right decision is, they go forward with it with the discipline and the professionalism that they need to get to the next stepping stone. If I now were faced with this, I would recommend my doctor and his team to anybody that was going to have the kind of surgery that I had. That's number one. Number two, the Bloomington Hospital, I think I already told you this, was chosen by me because of its proximity to my home. It's in Bloomington, Indiana. I live in Bedford, Indiana. Bloomington, above all else, was the closest place to home I could have this surgery done. And that was the primary governing factor to me making the choice to choose Bloomington. Since that time, I've had 4 or 5 days experience with them, and I've shared my observations with them, and I'm going to share them with you. Let me first say that if I had to do this again, even knowing what I know now, I would still choose Bloomington Hospital. I know more about them than I did before I did the surgery. One of the things is their food's terrible, but even after I got home for the first day or two, all food was terrible, so I can't even be a good judge about how terrible their food was. The next thing is their nursing staff is overworked and they're understaffed. And I commented to them about that observation, and their answer for that was, it's like that anywhere you go. And that may be true. I know that that probably is true to some degree, more so in other places than some places than others. But their nurses are working too long a days, 12 hours plus, some of them more than that. There's just not enough of them to go around. And many of them are what I'm going to call newbies. I'm not saying they're not qualified to do what they're doing. Not even say that they aren't doing their level best. I never saw what I perceived as incompetence. I never saw what I perceived as someone who was disinterested in their job or was shirking their duty or lazy. I never saw anything like that. They were on things like duck on a June bug anytime I had a need. But some of the people just didn't have the experience. Maybe they'd been 3 weeks. Maybe they'd worked 4 months. And, some of them did have the experience. They'd been doing this for a lot of years, knew where everything was, knew what everything was. I'm just saying, in general, the nursing profession right now, we need more nurses, and we need to start making them fast and training them more thoroughly and giving them opportunity to gain experience. That's enough about that. Let's go ahead. Something else. Since I came home, I have ordered and will be delivered soon a brand new recliner. Even though I have however many I told you I had in this house, 10, or I'm sure I own more than 10 between what's here in the house and what's in the room up there in the barn. I've got lots of recliners. None of them did what you need your recliner to do, and that is any position that you need to be in, any functions that you have to have getting up, getting down, laying down, sitting back up, all those kind of things that you must do. You want the power of the machine to do it for you. You want somebody pushing a button to make that happen. You don't want people having to press things down with their hands or their legs or their feet, get hold of you and raise things up, all that kind of stuff. My wife is almost as old as me. Man, she is precious. She is a trooper. She is a warrior. She is there for me in every need, but my wanting to get home so she could stay close to me, be the one that having to do all these things that she didn't have the equipment to do with, I put an extra burden on her. And you don't want to do that. You want to have a machine in your home ready to do those things where all she has to do is say, here we go, and push a button. And that can happen. There are such machines as that. When somebody suggests that you need one, if you're going to have bypass surgery and go through the recovery at home, buy yourself a recliner that goes through all its motions, including standing you up. The feet come up, the back goes up and down, the feet go up and down, the chair goes up and down because somebody pushed a button. You need one of those. I made the mistake of thinking I didn't, but I did. I told you that one of the mistakes I made was not going into that interim rehab facility between the hospital and coming home. If you have the chair I just spoke of that does all these functions, and you're making the kind of progress that I was making when you leave the hospital, if you have that chair at home when you get there, you can skip going to that rehab place, just like I did. If I'd had that chair at home, I didn't need to go there. Because I didn't have that chair at home, I did need to go there. Not just for my sake, but for the sake of those that are trying to care for you at home. They need that assistance. So I'm telling you, take advantage of that 2 or 3 extra days if you don't have that equipment in your home. If you do have that equipment in your home, you can skip those 2 or 3 days that they want you to transition from hospital to home. I told you at some point in this video that I totally reevaluated my ability to rate pain on a scale of 1 to 10. I had to revamp all my thinking on that. I'm going to give you an example of, yet again, that. When you go through this surgery, one of the things that happens is they put a bunch of tubes in you. You got tubes sticking out of you everywhere when you first wake up that first day, and they begin taking those smaller ones out one at a time. But there are some pretty large ones that go in down low on your rib cage and extend up into your chest, where they got all these different tubes bigger, I don't know how many of them there were, 2 main ones that carried 5 to 6 smaller ones each into your chest cavity to help facilitate the drainage of your chest cavity and your healing immediately after the surgery. And all that comes out of you into a bag, and it's monitored, and there's a reason for all of it. But it is extremely uncomfortable. It is extremely painful. Any of these kind of movements that you have to make while those tubes are still in you. So on day 2, they came in and told me what they were about ready to do. Of course, I don't know what to expect. I've never done this before. Just their description of what they're going to do is like, please, please. I don't know whether I can do this or not. But look forward to that. When you have that surgery, late day 1 or early day 2, when they talk about getting that 2 big chest drainage tubes and all the tubes that are encased by those, when they talk about getting those out of you, don't slow them down. Don't slow them down. Do everything you can to get those out. Nurse or doctor or technician or whatever it is in your case pulls those out. Just they won't let you raise your hands, but raise your spirit. Things are so much better from then on. That's one of those things that's uplifting. And I'm just telling you that because it's unbelievable how quickly you can recover from the first day into the second day and into the third day, just from some simple things that are going to happen to you. I want to encourage you. I don't want you to wake up that first morning when they're trying to put you on the scales and think, this is it? I wished I'd have died. Don't think like that. Know that it's getting better. Know that great relief is coming. I hope some of this helps you. I may talk about it a little more in future videos, but I think I've bored you with it long enough now. I'm the Hard Times Guy. You have a good day.